Health assessment is an important nursing responsibility. Remember, assessment is the first step in the nursing process. Health assessment includes the health history and the physical assessment. During a health history, the nurse interviews the patient about health status, including any problems. This video focuses on the physical assessment. As you'll see demonstrated in this module, performing a complete head-to-toe physical assessment requires both technical skill and the ability to make the patient comfortable. During the physical assessment, you'll collect objective data about the patient using your senses. The senses guide the examination techniques: inspection, palpation, percussion, and auscultation. While performing the assessment, identify and differentiate normal and abnormal findings. As a nurse, it's important for you to have excellent assessment skills because a thorough health assessment provides the foundation for a nursing plan of care.
Okay, so I think we pretty much have everything.
All right, Mr. Shepard, that wraps up your health history interview. If you'd like to get changed into a gown, we'll be back for your head-to-toe assessment.
Sure, sounds good.
Okay, now my student Anna will actually perform the assessment, and I'll be here to observe, all right?
Oh, that's not a problem.
Okay, well, you get changed, and we'll be back when you're ready.
Okay.
Thank you. Feeling okay? Ready to go?
Oh, just a little bit nervous. I've only seen the head-to-toe assessment in bits and pieces, so this is my first real go-through.
Well, don't be nervous. I'll help guide you through it.
I'm just afraid I might forget something.
Everybody feels that way at the beginning, but you'll get comfortable, so don't worry. Now, there's no one right way to integrate the entire physical exam. You just have to get into a routine that works for you.
I'm just afraid if I go through everything, I'll have the patient in there for 4 hours.
Well, not everything has to be done individually. You'll find you can combine some of your body system assessments.
How?
Well, let's say when you're assessing legs, you're examining the parts of the skin, the color and condition of the legs, and at the same time you can be assessing the peripheral vascular system, the pulses, the color, edema, lesions of the legs, right?
Mm-hmm.
And at the same time you're looking at the musculoskeletal system, assessing movement and strength.
Oh, okay, so I don't have to go through every system individually on its own from head to toe.
Not at all. The procedure takes time, but shouldn't be unreasonable.
Whew, good.
Also, if you missed anything in the health history, it's okay to ask about it during the physical exam.
Okay, so if I'm assessing the heart, then I can ask the patient if he's had any chest pain recently.
Exactly. Okay, let's go over what we know so far. What did we see in our initial assessment?
Well, the patient's in for a routine checkup.
Mm-hmm.
I did the interview, and I didn't find anything abnormal with his past health history, family history, lifestyle, and health practices.
Did he have any specific health concerns?
None that he brought up during the interview. If he had, I would have asked questions that were focusing on that.
Right. Now, you can also tailor your physical assessment to that concern.
Okay.
So what about the general survey? What were your findings?
Nothing abnormal there either. His grooming was good, physique, hygiene, all normal. Vital signs were within normal limits. Temperature, pulse, respiration, blood pressure, and so were his height and weight.
Okay. Now, what if he had sought attention for pain?
Well, I would have treated that as the 5th vital sign and then asked questions that related to his pain, like the intensity, location.
Look at you, doing good.
Okay.
Okay, what about Mr. Shepard's mental status? Do you think he looked alert and oriented?
Mm-hmm. He answered all my questions appropriately. Facial expressions were normal. Speech pattern was normal. He cooperated, and it was fine.
Great. Mental status is also part of the neuro exam, so you've already started that part. Now, if you'd seen anything abnormal like inappropriate behavior, bizarre speech, confusion, a change in mood, or head trauma, then we would have performed a full mental status exam.
Okay.
All right, well, Mr. Shepard should be ready to go, so relax, Anna. You know your stuff.
Okay.
Let's go.
Okay. Mr. Shepard?
Come in.
Hello?
Hello.
Okay, so as we said before, I'm going to be doing a head-to-toe assessment, starting from the top and working my way down. And we'll only expose one area as we assess it. I'll ask you to change positions, sit, stand, turn this way or that. And if there's anything that's uncomfortable, you let me know. Okay?
You look at everything.
Mm-hmm.
That sounds pretty serious.
We prefer to think thorough. We want to make sure we get all the information accurate and that we don't miss anything.
Okay, then. I can respect that.
All right, now I'll be talking Anna through it, and we'll be going one section at a time, so don't mind us, okay?
Sure. Hey, I might learn something today.
You just might.
Okay, so let's get started. You can just sit up and have your shoulders back, and then just hold your head straight and still. Okay, so the first thing I do is check the size and shape of the head. And then I checked for distribution, color, and consistency of the hair. Okay, and then I move on to the face.
What are we looking for here?
Facial expressions, any rashes, lesions, symmetry. All right, now I want to test cranial nerve 7. So if you can just smile. Okay, show me your teeth. Okay, good. Blow out your cheeks. Okay, and raise your eyebrows. Okay, and then close your eyes really tight. Okay.
Okay,
That's good.
Now you want to test for sensations. This is cranial nerve 5.
Okay.
Mr. Shepard, I'm just going to ask you to close your eyes, and Anna's going to lightly touch your face, and I want you to tell us where you feel it, okay?
Okay. On my left cheek, forehead, chin.
Good. Now you can open your eyes. Anna, now you'll palpate the temporal artery, which is located between the top of the ear and the eye.
Okay. How's that feel?
Fine.
What are the normal findings, Anna?
Well, the temporal artery should be non-tender and elastic.
Good. Now to the eyes. Okay, you recently had a vision test and a fundoscopic exam, right?
That's right, about 2 weeks ago. Everything checked out fine.
Great. Then we'll go right to inspecting the external eye. You'll look for abnormalities with the eyelashes, the eyelids, and the overall position of the eyes.
Okay, just look at me. All right, Mr. Shepard, now I'd like to check you for pupillary reaction to light.
I'll dim the lights, okay?
Okay. So if you can just focus on the poster there. All right, just hold still. Okay. Each pupil got smaller.
And there we go. The normal response is constriction.
Okay, let's see. What's next?
We test the accommodation of pupils.
Okay.
What's that?
This is a test where you focus on a distant point to a near point. So you're going to hold that about 12 inches away. Just focus on the pencil, Mr. Shepard. And now Anna's going to move it forward.
Okay. Again, constriction of the pupils and convergence of the eyes.
Now to the ears. We start at the auricle, the tragus, and lobule. And what are we looking for?
Well, we're looking for smooth skin, any lumps or lesions, and to make sure that the color of the skin is consistent with the facial color.
Right.
Okay, and then I palpate the auricle. And then I check the mastoid process for tenderness. Does that feel okay?
Yes.
Have you noticed any changes in your hearing recently? Anything like having to turn up the volume of the television or something?
No problems. No changes from the usual, no.
Okay, good. Well, just remember that if you have any changes in your hearing or speech, be sure to schedule a hearing test, okay? Now for the nose. We're going to start with the external. You're looking for color, shape, and consistency. And you'll want to palpate the external nose for tenderness.
Okay. Is any of that tender?
No.
Oh, okay. Now I'd like to check patency of airflow through the nostrils. So can you take one finger and hold your nose one side and then take a deep sniff in? Okay, and the other one? Okay, good.
Have you had any problems with your sense of smell?
Not at all.
Okay. Now, if patients hear about a concern with his nose or sinuses, you would inspect the internal nose. You would also palpate the sinuses and transilluminate the sinuses with a pen light to check for fluid or secretions.
Okay.
Moving to the mouth. Let me get some gloves for you, Anna.
All right.
You want to make sure you have a tongue depressor and a pen light.
Okay, I've got that.
Okay, what are we looking for?
Well, we're checking the lips for color, consistency, and any lesions. And can you open your mouth so I can see your teeth? Okay.
Be sure to note the number and condition of the teeth, and also inspect the gums and buccal mucosa for unusual color, consistency, or lesions.
Okay, so just open your mouth. Okay, say ah.
Ah.
Okay. The rise of the uvula is normal.
Okay, now you want to test the gag reflex. This tests cranial nerves 9 and 10.
All right, so Mr. Shepard, I'm going to touch your soft palate, okay?
I hate this part.
Just take just a second.
No, not a problem.
Okay, let's open up. Stick your tongue out a little bit. Okay, that's it.
Have you experienced any trouble with or changes in your sense of taste?
Nope.
Okay.
Okay, so we move on to the neck, and I check for swelling, any lesions, symmetry, and for masses.
Great. Now let's test the range of motion.
Okay, can you turn your head to the right and touch your chin to your shoulder? Okay, and turn your head to the left, chin to the shoulder. Okay, back towards me. All right, now touch your right ear to your right shoulder.
Oh.
Like this. All right, and then the left. Okay, chin to the chest. Okay, into the ceiling.
Smooth and controlled.
Thanks.
Okay, now we should palpate the preauricular nodes right here in front of the ears,
Okay.
then the postauricular nodes behind the ears.
Okay. Checking for swelling, tenderness, or hardness. Does it feel okay?
Fine.
Okay. Now some of these aren't palpable, right?
That's right, lymph nodes should not be palpable. That's a normal finding.
Okay.
Okay, now what, Anna?
We move on to the trachea.
Good. Just put your finger in the sternal notch and check to see that everything is midline.
Okay.
Good. Now the thyroid gland. You can actually use your index finger and thumb to find the key landmarks.
Okay.
And again, like the lymph nodes, the thyroid gland isn't usually palpable. And just so you know, if the thyroid gland is enlarged, you would auscultate for bruits.
Okay, so I will use the bell of the stethoscope for that, right?
Yes, the same as with the carotid arteries. We place the bell directly over the artery, but before you do that, palpate the carotid arteries.
Okay, so one at a time.
Bilateral palpation may reduce cerebral blood flow.
Okay. All right, I feel both of them. Okay. So let me just take a listen here. Okay, look this way and hold your breath. Let it out. Let me check the other side. Hold your breath.
No blowing or swishing sounds?
Nope.
Okay. Now we move to arms, hands, and fingers.
Okay, Mr. Shepherd, if you can stand up for me. And then I just inspect the upper extremities for overall skin coloration, any lesions, texture, moisture, any masses. Okay. Everything looks symmetrical. No swelling or lesions.
Okay, now what?
Okay, just keep your hands straight here and then put your hands together. Right, and then straight over your head with your elbows straight.
Elbows straight.
Yes. Okay, now flex your elbows and put your hands behind your head. Good. Now can you bring your right elbow to your forehead? Okay, and then the left? Okay, good. Now just straighten out your arms. Turn your palms up. Okay, down. Okay, good. You can sit down.
Okay. Now to palpate the brachial pulse.
Okay, let me have your arm here. Okay, and this one. And I also want to check the radial. All right, let me check this one. Okay.
Okay, and then?
Another pulse. I'm just trying to remember which one. Which one is it?
Ulnar.
Ulnar, right. It's on the tip of my tongue. Okay. Just feel a little bit more faint. That's normal, right? Okay, that's good.
Okay, now for range of motion of the wrist.
Okay, can you just hold your hands out? All right, and bend your hands up and then down. Okay, now I'm going to test for muscle strength. Okay, so what I want you to do is push against my hands. Okay. Okay, I would rate him as a 4 or 5 with strength.
Okay, now you want to inspect the palms of the hands and palpate for temperature.
Okay, so just turn your palms over. Okay. Okay, looks good. All right, just turn them over. Okay. Nail beds are nice and pink. Okay, capillary refill is prompt, and there's no cyanosis.
Now why don't you look at the range of motion of the fingers?
Okay, so just bring your fingers straight out. Okay, make a fist. All right, put your fingers back out again, and then make your fingers go down.
Down? Okay.
And then up.
Up.
Good. Keep your fingers together, and now bring your thumbs out. Okay, back. All right, good.
Excellent, Anna.
So now we're going to go on to rapid alternating movement of the hands. If you can just put your hands on your thighs like this. All right, and then turn your palms up, back down, and then slowly increase your speed doing that. Okay?
Now what are we looking for with this, Anna?
Okay, good. Just making sure there aren't any uncontrolled movements or tremors. So now I want to test for sensation for your hands and arms, and I'm going to touch you lightly in these places, and you're going to tell me where I'm touching you, okay?
Okay.
All right, so just close your eyes.
You're on my right hand.
Okay.
You're on my left arm. You're on my left hand. Right arm.
Okay, good. All right, so just keep your eyes closed, and I'm going to test the sensitivity and position of your fingers. So what I want you to do is just hold your hand up, keep your eyes closed, and spread your fingers out. You tell me which direction I'm moving your fingers, okay?
Okay. You moved it up. Down.
Okay.
Up. Up.
Okay, good. All right, so just relax your arms by your side here. You can open your eyes. Okay, I'm going to go to the back and untie your gown now.
Sure.
This shows us the posterior thorax. What's the first thing we do?
Well, I want to check the shape and configuration of the posterior thorax and the scapulae, and I don't see any spinal abnormalities.
Mr. Shepard, have you experienced any difficulty breathing, shortness of breath, or coughing?
No problems like that.
Okay. Anna, note his posture when breathing.
Okay.
Then you want to palpate for tenderness, masses, lesions, and sensation. Now for crepitus.
Okay. This is when air gets into the tissue, right?
Exactly. It would give a sort of crackling sensation.
Okay. So now check for fremitus.
Use the ball or ulnar aspect of your hand.
Okay. Mr. Shepard, can you say 99, please?
99.
Okay. Again?
99.
And one more time?
99.
Okay.
Now, Anna, evaluate chest expansion at levels T9 or T10.
Okay. All right. Can you take a slow, deep breath for me?
Sure. I was planning on it anyway.
Okay.
Your thumb should move about 5 to 10 centimeters apart.
Okay. Again? One more time. Okay. All right. Good.
Now percuss for tone, starting at the apices of the scapula, moving across and down, comparing sides. Do you remember the normal percussion tone of the lungs?
Resonance, right?
Very good. Okay, Anna. Now why don't you auscultate for breath sounds and for adventitious sounds?
You mean like wheezes, sonorous or sibilant, crackles, pleural friction rub, like that?
Exactly. Be sure to use a zigzag pattern.
Okay. All right, Mr. Shepard, if you can take some slow, deep breaths with your mouth open. Okay, Mr. Shepard, your lungs sound nice and clear. Just going to move around this way to the front here and lower your gown.
Okay. We're looking at the anterior aspect of the chest. We'll examine the anteroposterior diameter of the chest, the slope of the ribs, the color of the skin. What else?
Well, I don't see any evidence of a barrel chest or any chest abnormalities. I also want to check the intercostal spaces.
And what are we looking for?
Bulges, retractions, use of accessory muscles.
Now, Mr. Shepard, just breathe normally for a moment. And Anna, you want to note the quality and pattern of respirations. And what do I mean by that?
Rate, depth, and rhythm.
Exactly.
Okay. So now I just want to check the chest for tenderness and sensation.
Of course, at the same time, you'll be assessing for lesions, masses, and fremitus.
Okay. All right. So let me check for fremitus. Just say 99.
99.
Okay. Good.
Okay. Now you want to percuss for tone at the apices of the clavicle, and then again at the intercostal spaces, comparing sides.
Okay, so now I want to auscultate for anterior chest sounds and adventitious sounds. Deep breath. Again. Again. Okay, sounds clear.
How do we assess skin turgor?
Well, I pinched the skin under the clavicle. Is that okay with you?
Sure.
Okay. All right. And I just want to make sure that it returns to its original shape. And the last thing I want to do is palpate the breast tissue and the axillae.
Well done.
Thank you. Okay, so I'm going to get you to lie back here. And we're going to assess your heart now.
What do we do first, Anna?
Well, we check for visible pulsations, and then palpation of pulsations and the apical impulse.
Right. Use the palmar surface of your hand in the apical or mitral area. Once you've found the pulse, use 1 or 2 finger pads for an accurate palpation.
Got it. Now palpate the apex. The left sternal border. And the base of the heart for any abnormal pulsations.
No abnormal pulsations or vibrations?
No.
Then let's move to auscultate over the apex to listen to the apical impulse. What are we assessing?
Heart rate and rhythm, and I use the diaphragm, right?
Yes. Now what do we do if it's irregular?
Then I would auscultate for a pulse rate deficit.
Right. Then we auscultate the aortic area, the pulmonic area for S2, Erb's point for murmurs, the tricuspid area, and the mitral area for S1.
Let me make sure I have this right. S1 is the lub of the cardiac cycle, and S2 is the dub of the cardiac cycle.
That's right. And the extra heart sounds are S3 and S4.
Okay, so we're going to get you to sit up. I want to
Sure.
check for S3 and S4. We got to lower the table. Pull this out.
Okay.
Put your legs up there. I'm going to slide your arms out of the gown. I'm going to get a drape here. Okay, let's get you to lie back.
Okay.
Okay. Now I want you to turn on your left side for me.
All right. How's that?
You all right?
Yes, is that okay?
Okay, Anna. You'll use the bell of the stethoscope to listen to the apex of the heart.
Okay. Okay, nothing abnormal there.
All right, time for the abdomen.
Okay, so just turn on your back now.
Okay.
Okay, and just drop your arms to the side.
All right.
That's good.
Now, what are we looking for?
Just visible pulsations and overall skin color, striae, vascularity, lesions, rashes, masses, scars.
Distension?
Distension, yes.
How do things look?
The skin is a little bit more pale, but nothing abnormal.
Okay, be sure to note also the location, contour, and color of the umbilicus.
Okay. The skin looks the same as the surrounding skin, and the umbilicus is midline.
Okay? Now you want to note the symmetry and the contour of the abdomen. The abdomen is flat and evenly rounded, right?
Mm-hmm.
Okay. And lastly, there are no aortic pulsations or peristaltic waves visible?
No.
Okay.
So, you know, what I don't understand is why is the sequence different with the abdomen?
You mean why do we auscultate after we inspect?
Mm-hmm.
This is so you don't alter the pattern of bowel sounds.
Oh, right, okay.
Okay, so when we auscultate, we're actually assessing for bowel sounds. Like what?
Frequency, intensity, pitch.
Right. You should hear some soft clicks and gurgles at about 5 to 30 a minute.
Okay.
Then we move on to vascular sounds like a bruit.
Okay. So I auscultate the aorta.
You want to use the bell for that, Anna.
Oh, right. Okay, so auscultate the aorta. Now the renal arteries, iliac arteries. So now check the femoral arteries. We'll slide this under here a little bit, okay? Okay, no abnormal sounds.
Very good.
Did I get all of them?
Yes, you did.
Oh, great.
What's next?
I need to percuss for tone.
Okay, now make sure you cover all 4 quadrants.
Okay, so normally I would expect tympany over the stomach, and when I get to the more solid organs, it's a little more dull, right?
Right.
Okay.
Okay, now lightly palpate the abdomen in all 4 quadrants.
Okay.
And why do you think we do this, Anna?
Just want to check for muscular resistance, any enlarged organs, masses, tenderness. Any tenderness or anything there?
No.
It especially helps us detect an enlarged liver or spleen.
Okay. All that feels okay?
It's fine.
All right, that's good. Okay, so now we're going to move on to the lower extremities. Okay, I'm just going to have you replace your gown and we'll rearrange this drape here.
Okay.
Got it?
We're looking for skin coloration, texture, moisture, and edema.
Okay, and also hair distribution.
We start by assessing the joints of the hips.
Okay, so I'm going to check the range of motion of your hips.
Okay. What do you need me to do?
Just lift your left leg up,
Right there.
all right, and bring it to your chest. Good, that's good, good. All right, and now your right leg, same thing. And bring it to your chest. Okay, good.
Good. Now we'll palpate the femoral pulses.
Okay, just slide in here a second. It's nice and strong.
Okay. Now let's move to the knees and the popliteal pulses.
Okay, so just slightly bend your knee here.
You want to get
That's
your
good.
thumbs on top there and get the fingers deep in the bend of the knee.
Okay. All right, I got that one. Okay, other leg. I can feel it. Okay, so we move on to the ankles.
There we assess the dorsalis pedis and the posterior tibial pulses.
For the dorsalis pedis, I apply pressure right on the inside of the big toe on top of the foot, right?
That's right.
Okay. Okay. It's nice and strong. Okay, and for the posterior tibial pulse, it's right in the groove here between the ankle and the Achilles tendon. Got it. Okay.
And then we test range of motion.
All right, so lift your feet down and bring your feet out, in, point your toes up, down, good, up again, down again. Okay, that's
Okay.
good.
Now, like the hands, we assess capillary refill. Just press the nail and wait for the color to return. The pink tone should come back immediately.
Okay. It's prompt.
And now we test for light sensations.
Okay. If you can just close your eyes. I'm going to touch your legs and your feet, and you tell me where you feel me touching you. Okay?
Okay. That was my left shin. Right foot. Right shin. Left ankle.
All right, let's look at position sense, Anna.
Okay. If you can just tell me which direction I'm moving your toes, okay?
Up. Down. Down. Up.
Okay. Good. Okay, so now we're going to move on to the heel shin test, and you can open your eyes. What I want you to do is take your right heel and slowly move it down your left shin.
My
Right heel.
Okay.
Good. Nice and smooth. Okay, and do the same thing with the left.
Okay.
Okay, good.
Now,
I want to check your patella reflex, so I'm just going to have you sit up.
Okay.
I'll push this back in here. And then just relax your legs over the edge here. Sorry, that hurt?
Just got me surprised.
Okay, good. Okay, so we're almost done. I'm just going to secure your gown here, and then I'm going to ask you to stand up.
Okay.
I'll take this, Mr. Shepard.
Okay. All right, so now I'm going to check for spinal curvatures. Can you just lean forward like you're going to touch your toes? All right. Okay, I don't see any spinal abnormalities.
Good.
Okay, you can raise back up now.
Let me secure this other tie for you, Mr. Shepard.
Okay, thanks.
There you go.
And now just take a brief walk around the room.
Go for a stroll?
A quick stroll.
Okay.
Okay,
Okay.
Anna, why don't you talk through Romberg's test?
Okay, yeah, just keep standing. Put your feet together.
Okay.
And then your arms just at your side.
All right.
Now close your eyes. Okay, now bring your arms out to your side. Straight out, yes.
Okay.
Okay, open your eyes. I want you to take your right index finger and touch your nose. Good. And the left. Okay. Now I want you to do the same thing with your eyes closed, okay? Okay, very good. You can have a seat.
Okay.
Great job, Anna. Really, you did very well.
Thanks.
Now, the nurse practitioner or physician normally performs the genitourinary and rectal exam, so you're all set.
Okay, I don't know why. I just thought it was going to be so much harder than that.
See, it's all about the routine, right? Now, all you need to do is head back to the nurse's station and take care of the documentation.
Okay, so Mr. Shepard, everything checked out normal, and I really appreciate your patience. Thank you so much.
Hey, it was my pleasure. I hope I was a good example for you.
You were fine, Mr. Shepard. Thank you.
Thank you.
Okay, so we'll let you get dressed, okay?
Okay, thank you.
All right.